Good morning, everyone. Thank you so much for joining us today. I know that right now out there's a lot going on, and I wanted to just take a moment and state that and just let you know that I'm aware of that. And as we're going into this presentation today, I would like to be able to give you a space to feel whatever you need to feel at this time, at this difficult time. What I want to start with is to talk a little bit about what my goals are today as far as what I want you to get out of this presentation. I'd really like to talk about how we're all being affected and how the world and society is being affected by the events that are going on. And I'm going to specifically talk mostly about COVID-19 today. I wanted to also take a moment to be able to allow us to connect to what's going on inside within our nervous systems and be able to connect, be able to settle, so that we can take in this information as best we can. A lot of my training is in somatic experiencing, and I am a somatic experiencing practitioner, and so I will be talking about what orientation means and how important that is to our nervous system and how we can heal and how our bodies can settle with everything that's going on. And so what I want to start with is I want to start with a grounding or a meditation or whatever you want to call it. I like to call it orientation because it helps us connect to our environment. And so what I'd like to invite you to do, that regardless of what you're doing, where you are, whether you're at home, whether you're in your office, whether you're with peers, wherever you are, just take a moment and explore your surroundings. And that can look like a lot of different things, whether it's allowing yourself to feel your body sitting in the chair or the couch or bed, if you're in bed right now, to be able to just feel what that feels like to be there and to be sitting, lying, etc. And then I'd like you to take your eyes and look around the room, and I'll do it with you, to just kind of explore what your surroundings look like. You might even be orienting to me in the video and be able to see like what's behind me and my surroundings. It can be helpful to connect to our environment, and especially to what I'm going to talk a lot about today is faces and facial expressions, because it's really important right now in what we're going through. If you have a window, take a look outside your window. If you're outside, take a look at the surroundings. I'm not sure where you're located, but maybe you have trees, maybe you have water, maybe if you're here in Arizona, you have the desert. You can also feel the temperature. If you're inside, allow yourself to connect to if it's a cool temperature that feels good or a warm temperature that feels good, or maybe it's too hot. It was 108 degrees here yesterday, so it can be a little warm, at least where I'm at. And so to be able to connect to whatever you feel, and it doesn't have to be positive. So I want to make sure that I remind that, especially during this time, not everything is going to feel comfortable, not everything is going to feel positive. And so we want to be able to honor the things that are not. Allow yourself to notice what happens inside your body. Maybe you're feeling good. Maybe there's joy. Maybe there's sadness. Maybe there's grief. Maybe there's pain, physical pain, emotional pain. Just be aware of those things as we're going through this and kind of having this experience. And for those of you who are continuing to join us, we're just going through and doing a little bit of grounding and a bit of meditation prior to beginning to go into the information. And then as you're noticing internally, allow yourself to explore external again and be able to, again, take a look around at your surroundings, see what the air feels like on your skin, see what your body feels like as it's in a chair, lying down, maybe you're standing, just recognizing that. Being able to feel whatever it is you're feeling now, whether it's positive, whether it's negative. Maybe it's something that's comfortable, maybe it's something uncomfortable, maybe something really good is happening, maybe something really bad is happening or has happened. And so I just want to acknowledge all of those pieces and be able to go into this and just say, I appreciate you all for being here. And one of the last things I want to say before going into more of the information is right now, in this world, we are, as practitioners, as people working in the mental health field or medical field, we are holding a space for people unlike anything anyone has experienced that's currently living. And so I wanted to honor that and be able to say that you are holding such a strong space and such a safe space for people that's really needed and valuable right now. And also being able to notice your own space and us needing to hold our own space as we're supporting others through their healing. I want to talk a little bit about the nervous system and trauma responses, just because that's a lot of a precursor of kind of what everyone is noticing and what everyone is feeling out there right now. And the first of the responses that I want to talk about that we educate a lot about here at Sierra Tucson is fight, flight, and freeze responses, and how our nervous system can build up these responses over time. A lot of times what people experience is based on maybe it's prior trauma, or maybe it's something current happening, or maybe a concern of the future. There might be fear responses or anger responses, or maybe there's some kind of stuckness, and we call that freeze. It can also be known as dissociation. And so being able to discern kind of what we're feeling, and usually people are able to say, oh, well, I typically go to a fight response, or I typically go to a flight response, or oh, I freeze. And then other people are like, oh, I do all of the above. I do every bit of it. And there are also the combination responses of people who might be stuck in fight or might be stuck in flight. And then there's also the people stuck in freeze. And so I wanted to just begin talking about that as a result of everything that's going on and how we're all responding differently to the events that are going on in the world at the moment. We have such a need for social engagement and connectivity to others, especially it's a human connection. And so to be able to have this connection that we need to have with others, and we're not really able to get it right now because of COVID-19, we're having to find other ways to reach our social engagement needs. And so we really need the sense of connection, and we really need to be with other people. And it's a struggle to do that right now for obvious reasons, but also as we notice, as states started to open up again and people started going to do more social engagement events, they noticed a spike in cases. And so as that increases, we start to recognize, oh, it's not time for social engagement yet. It's time to be able to sit back and just kind of feel and be present with ourselves physically, with our families physically, and not really focus on going out there and doing things and being at a higher risk of infection. COVID-19 really has cut off it's cut off our ability to meet our need for social engagement and human connection. And so as we start to get that idea that I can go out, I can do something now because cases have decreased, it's that need that we try to meet of going out and meeting people and connecting to our loved ones, et cetera. And as we know and are still aware now, is that that's still a pretty high risk to do that. Social distancing and quarantine has really put us in a place where we are kind of forced to be away from other people. They were calling it at the beginning social isolation, and I was really happy when I first heard our chief medical officer towards the beginning of all this, Dr. Ghislaine Chetwal. She had said that it's a social distancing, not a social isolation, so that we can make sure that we're not isolating from other people and not disconnecting from other people. There's really just a distancing involved versus an isolation, because isolation implies that it implies a negative undertone, and also something that we as humans should not be doing. We need the social engagement, and so I wanted to honor that and be able to make sure that as we're going through all of this, we notice that social distancing is something that's a requirement. And in addition to that, there's also the piece of wearing masks that I'm going to talk about in a moment. During all of this too, it was a social distancing. We are seeing people who are losing employment. We are seeing people who are having to relocate from school, or maybe they're having to relocate their home, or along those lines of not being able to have what we've had. And it can be difficult to lose things like that. I was talking with someone earlier who had said that they were concerned that their child was losing out on their college experience because they're doing all of their college virtually right now. And so that's something to note. And also to be able to say that we live in a pretty interesting time when we are able to receive education and we are able to still have employment via virtually, to be able to connect and still have some connection with other people. It's not the same as person-to-person connection, but it's connection nonetheless, which is still social engagement that we need. In that, there's also the family of origin dynamics where people who go back to their homes, maybe they have a parent who's an alcoholic, maybe they have a sibling who has mental illness, depression, psychosis, etc. They're going back to these family of origin dynamics that they needed to get away from at some point. And so there's also noticing what happens in the nervous system as we're connecting to, or more or less disconnecting from, the things that our system needs. And so if I have a system that has a lot of fight and flight activation when I'm around my family, if you put me back in my family household, I'm going to have to suppress a lot of that, and then therefore that turns into freeze. And as that happens, we start to recognize that we're hindering our natural responses that we need to have in order to have resiliency. And therefore our window of tolerance might start to decrease and get smaller over time, when we really should be able to have our nervous system healing capacity to process through our fight and flight responses instead of shutting them down or hindering them. Also at this time, we're noticing increases, or at least I've noticed increases as far as our admissions here, in people who are isolating more at home and are drinking, people who are getting more into their addiction, people who are experiencing more depression. Maybe they've lost, employment, lost a loved one through this or something in that regard, and they're experiencing more mental illness issues. And so as a result of that, people are having to receive treatment for themselves and be able to get more support than they have had before. We're also blessed in a time, and I'm going to talk about this more towards the end, that we're able to still have connections with people. We're still able to do therapy via telephonically and be able to have these senses of help for people. I'm very grateful that Sierra Tucson is still able to support people with admissions and being able to have them get the treatment that they need, and also to have other treatment facilities out there that are also providing treatment and being able to support people in this difficult time. I wanted to take a moment to talk about masks, because it's very interesting, because as we are going through all of this, there's a lot of attention around masks, and it's mostly because what the CDC says is that we can establish a sense of safety through the use of the masks. What I also know is that for people who are using masks, what happens is there's a big portion of the face that's not shown during this time, meaning that you're not really seeing a lot of facial expressions. As far as attachment and healthy and secure attachment, we do need that kind of connection. And so you are able to see my eyes while I'm doing this, and you can see that I'm emoting. There are some people who do not emote, such as this, and maybe they have more of a flat affect. But even if somebody isn't wearing a mask and are talking like this, maybe they're monotone and there's just kind of this flatness, you can't really sense or can't really see or feel what feels good. And so if somebody's wearing a mask, it may seem like that because you're not able to see the facial expressions. You're not able to see kind of what they're emoting or how to take it. It's kind of like having a text conversation with someone, and if they're not using emojis, maybe you don't know what they're saying, and so it's creating that disconnect. But I also want to say too that the masks are keeping us safe, and via telephonically and via phone, we can still have the sense of emotion. There's also the sense some people are wearing thicker masks and their voices are more muffled, and so there's a breach in communication. So that can look like a lack of social engagement or a disconnect from social engagement. And so I wanted to mention that. And as we're talking about attachment, as we're talking about our nervous system having the need for healthy, secure engagement, it's difficult to have that when we have something kind of preventing most of our face from being seen. There's also, as a result of masks and people not wearing masks or people wearing masks, there's a lot of activation out in the community. And there's a lot of different populations where there's high sensitivities happening. And as a result of the high sensitivities, we're seeing a lot more negative response to a lot of different things in the news. And we're seeing a lot of things. I can't even watch the news at this point because of all the negativity that's happening. And yet what we see is it's almost as if during COVID, everyone isolates, everyone goes into social distancing and disconnecting from others. And during that time, because of family of origin or whatever else is happening, they are noticing or maybe they're not noticing, but what's happening is their levels of activation are increasing. Their fight and flight responses are increasing, but they're not able to go to the gym and exercise depending on the state and be able to get some of this out. They're not able to do some of the things that they were able to do before to take care of themselves, such as people who go to nail salons, or people who go and get their hair colored or done, or they're not able to do regular self-care things. And since they're not able to do that, again, that activation is increasing. But since they're not able to do that, they have to hinder it. And so freeze develops over this high activation, and we kind of get stuck in this, in our stuff. Our feelings are getting stuck. We're not able to do things. Maybe we're using substances to cope. Maybe we're shutting down and staying in bed, depressed all day. Maybe those are things that we're using to cope. But what we notice is once things start to open up again, and once society starts to say, hey, maybe it's okay to go out again, everyone goes out into this frozen level of a high activation. And as they do that, bigger things happen. And what we're noticing in the news also is a lot of those highly activated people entering these difficult situations. And so it seems like almost every day in the news there's something new happening. Maybe somebody has done something, or maybe there's just so much going on. And I wanted to honor that even though there is so much going on out there, we are able to hold a space for our others, for the clients we work with, for ourselves, and be able to have a sense of healthy connection regardless of all of that. And I want to say that even though there are all of those things out there that are happening that are difficult, I also want to honor that we are able to hold the space for those people who do need that additional support. Because of dysregulation, all the high fight and flight responses that are occurring, what we notice and what's happening is we're getting those high levels of rage, those high levels of panic and fear. Maybe people aren't going out of their house at all because of the fear of being infected with COVID-19, or maybe there are people that we're hearing about that are going to parties in an effort to get infected. And so there's the different extremes and how we kind of cope within our responses, and how our level of health depends on what our nervous system is feeling, and what's going on for our systems, and what our fear, rage, panic, terror levels are. And what I notice is people are having that higher level of activation, and people are having the inability to be able to cope in a healthy way as they did before, and therefore the unhealthier coping patterns come into play, or can come into play. People who have prior trauma are more susceptible to being more activated by these types of things. This comes from having a sense of, maybe it's developmental trauma from childhood, maybe it's attachment-based trauma, such as people who have had unhealthy family dynamics growing up, or maybe someone has been adopted. And so people who have those kinds of past possible developmental trauma pieces, they might be more susceptible to having this rage, or to having this panic in regards to COVID-19, to be able to connect and to be able to have social engagement with others. And so that's when those really high levels of activation increase faster for people who have past difficulties with other types of trauma that have happened. Also, people who have complex trauma, or who have developed PTSD, those are people who are also more susceptible to having these high levels of activation. If you don't have prior trauma, can you receive levels of activation through this? Absolutely. And maybe there are people that you know, or maybe there are people who know people that know someone who's been directly impacted by COVID-19. And I wanted to take a moment to just say that, and say that this is a time right now where we're not fully aware of how things are going to go, and we need to take as much precaution as we can in order to feel safe. And so towards the beginning, when I was talking about orientation and being able to connect to your environment, that gives us a sense of being able to check around our space and be able to see what's happening right now that lets me feel safe. And so if I'm able to connect to safety in my current environment, or in my current surroundings, I'm going to be more likely to not have those high levels of activation that are going to put me in a state of maladaptive coping or ways of taking care of myself that are not healthy. The last thing I want to talk about prior to going to questions is the things that we've gotten out of this that have been supportive and have been helpful. And I want to say that we as humans, we have found a very interesting way of adapting during this time of COVID-19, being able to connect, still find ways to connect to other people because social engagement is so important. And I want to say that I'm really glad that I'm not at an event doing this presentation with a mask on my face, because I don't think that it would get the entire sense of my facial features or exactly what I was trying to want to convey to you, because of how we need this kind of connection with other people, with the eyes, the mouth, the whole features. It's really important with our attachment-based systems. And I think about that with a mother who's holding her newborn and looking down upon the child and smiling and having the open, healthy, happy connection versus the one who doesn't look at their child and creates a disconnect that can create more trauma later on. Because we're able to adapt so well and have been able to adapt so well to this, we've been able to find avenues such as webinars like we're doing right now. We also have avenues such as Zoom or other types of digital connection where we're still able to work with people in telephonic capacity to be able to still be present for them and still hold this space for something that's so strange and so difficult right now. And so, like I said at the beginning, I want to honor all of you who are able to hold this space for people, those of you who are still out there, who are still able to work with others and be able to provide them the resources they really need in order to have healing, not only from what's going on right now, but also from anything prior, any of the other things that people have struggled with. I did talk, and I wanted to say one more time about why facial features are so important and the impact of how our expressiveness can really be easing for someone else. And so if somebody's having a difficult time and I'm able to provide a soft, compassionate, empathetic space for them, there's going to be more of that vulnerability for healing. And if most of my face is covered, I'm not really able to do that as well with just my eyes. However, we still learn and we still adapt and cope with being able to be there for someone else, even if we do have a mask or wearing a mask. I also wanted to point out that going out, because there are things that we need to do that are essential, such as going to the store to get groceries, or going to get gas and those kinds of things. We be mindful, and especially because right now in our community in Arizona, we're having in public you're wearing a mask, and so it's what we do in order to help maintain safety. And so we're aware of that and being able to. There's something settling about seeing others wearing masks too, because you can actually know that they have the same goal in mind as you, as being able to establish that sense of health, that sense of support. And the last thing I wanted to cover prior to going to questions is the one thing I wanted to say in regards to, I recently assisted a training, and it was a virtual training, and one of my concerns going into it is I was afraid or concerned that maybe we wouldn't be as productive or as connecting as other trainings have been that I had attended in person. And one of the things I want to say is at the end of that training, I was very well convinced that the same space can be provided and that the same healing can occur even within that space. And so to be able to say that we can still connect to other people even through a training platform, the healing is still possible, and that doing virtual work is not totally unnecessary, because we do need to do this work even virtually right now as we can. So now I'm going to go to some questions. I want to thank you all for listening to everything that I've had to say, and I'm going to answer some questions that have come through here. Okay, so let's see. So someone said, I like using physical distancing as opposed to social distancing. I actually think that's a great idea because as we say social distancing, it's that idea that we kind of get disconnected from everyone completely. And physical distancing is that idea that, yes, I can keep 6 feet apart from you and still be able to have that connection. So thank you for saying that. And that's actually something that would be great to be able to say, at least for me moving forward. Okay, here's a good question. How does one manage the emotional peaks and valleys? I have to turn off the news to reduce stress, for example. Okay, so managing emotional peaks and valleys is definitely something that's going to happen during this time and even during times that are not like this, because we do have those things. And one of the best ways to manage those emotional peaks and valleys is to be able to find ways, healthy ways to cope and healthy ways to be able to settle. People who normally go out and exercise at the gym, they found ways to exercise in their homes. Maybe people who've gone to yoga classes can pull up yoga videos on YouTube and be able to do yoga in their homes themselves. Some people are doing virtual yoga classes or virtual fitness training, and they're able to still have that way to manage their emotional peaks and valleys. And that's a healthy way, some healthy ways to be able to do that. And I ask you, what's your healthy way? How do you manage your own emotional peaks and valleys? And what's most helpful for you, at least in a healthy way, to be able to cope with those things? Let's see. I find that current events impact my level of patience. I have less. What can I do to regain the qualities and attributes I feel I am losing because of current events? This is a really good question, and this is something that I'm very aware of too, as I have found myself, at least in the early stages of this, when I was wearing a mask and other people were not, in the grocery store, and kind of being aware of how close people wanted to be to you without wearing a mask, and not really noticing the aspect of physical distancing that needed to occur. And so being able to be aware, first of all, having the awareness of having less patience is a really big deal, because we're not all able to have that capacity to be able to notice that. But what can you do to regain the qualities and attributes you feel you're losing? I want to just kind of go back to finding ways, healthy ways to be able to cope, and finding things that are supportive for you. Some things that people are doing is they're finding new hobbies. They're able to do things that they've never been able to do before. Instead of going out and doing other things, they're able to connect to things at home. One of my loved ones has actually gotten more into music and has started to record some music during this time, and it's really interesting to kind of see how we can connect to our creativity, and instead of focusing on those things that are giving us less patience, being able to focus on things that we feel can be more helpful and safe for us to look into. And I'll answer one more question. How can we help a family member or friend through this when they aren't motivated? This is a really good question, because we are not only holding the space for ourselves and for our clients, we're also having to hold the space for our loved ones and people who might be struggling with this issue more than we are. And so one of the best ways, I believe, to do that is to be able to support and be able to be there for them and hold the space. The biggest thing is to hold the space for them if they're not motivated. If they are showing some kind of motivation and you want to be able to honor that, then you can. Although I would also like to make sure to say that we can't always motivate others, and we can't always have others do what we want them to do, but we can definitely hold a space for them and let them know that we're there, and let them know that we can support them. And that's exactly what we're all doing here, and what I'm very grateful to have been doing with you all today. I want to thank you so much for your time, and I want to thank you again for holding the space for yourselves and everyone else out there. Continue to be well, stay safe, and I look forward to seeing you next time.